welcome to the Clinical Liver Diseases video series. CLD is an official digital learning publication of the AASLD. I'm Dr. Sofia Bartlett, and I'm a postdoctoral research fellow at the University of British Columbia and the British Columbia Centre for Disease Control in Vancouver, Canada. And I'm the author of Hepatitis C virus prevalence, screening and treatment among people who are incarcerated in Canada, leaving no one behind in the direct-acting antiviral era. I'll present a summary of the main points from this review on behalf of my co-authors now. We reviewed more than 15 published estimates of hepatitis C virus antibody prevalence among people who are incarcerated in Canada. We found that proportions of people with hepatitis C antibodies ranged from 8.5% to 39.8%. And this is up to 40 times higher than the general population prevalence of hepatitis C antibodies in Canada. For this reason, increasing hepatitis C testing and treatment initiation in correctional settings is a high priority to be able to achieve the goal of the elimination of hepatitis C as a public health threat in Canada by 2030. Supervision of people sentenced to custody for 2 years or more in Canada is the responsibility of Correctional Services Canada, or CSC, who operate 43 institutions across the country, housing an average of 14,000 people per day. CSC has implemented universal or opt-out hepatitis C screening among all entrants to federal institutions and reports 80 to 90% uptake of hepatitis C screening at intake. Hepatitis C treatment is also available without any disease stage restrictions to people who are federally supervised. And several CSC institutions have also implemented harm reduction services, such as needle and syringe exchange and supervised consumption sites. Based off these policies, we believe that Correctional Services Canada is well positioned to achieve hepatitis C elimination within federal Canadian correctional institutions within the next decade, and that this model of care could serve as a best practices model in hepatitis C management in correctional settings for other jurisdictions. Supervision of people sentenced to custody for less than 2 years, or of people who are unsentenced or on remand in Canada, is the responsibility of provincial and territorial governments. Provincial and territorial corrections in Canada is characterised by a large number of annual intakes and releases due to the short average duration of incarceration. And this makes continuity of care on release to the community a major challenge for hepatitis C treatment scale-up efforts in these institutions. There are additional challenges, such as inconsistent hepatitis C screening at intake, fibrosis stage and incarceration length eligibility restrictions on treatment in some provinces and territories, and a total lack of harm reduction services in provincial and territorial corrections. Until best practices for hepatitis C management are modelled after federal corrections, hepatitis C elimination in Canadian provincial and territorial correctional centres by 2030 remains unlikely. And many people affected by hepatitis C may be left without timely access to treatment. There is now increasing evidence from around the world, including from the United States, Spain, and Australia, that test and treat all approaches to hepatitis C management within correctional settings are both feasible and cost-effective, and indeed result in the elimination of hepatitis C in these correctional settings. This evidence needs to be translated into policy and practice in correctional settings, as the elimination of hepatitis C by 2030 may not be achieved in Canada or in other jurisdictions, while the standard of hepatitis C care available in prisons remains suboptimal. On behalf of the CLD team, I hope you found this commentary on hepatitis C infection among people who are incarcerated useful. For more information about this liver disease topic and many others, please visit www.cldlearning.com. Thank you for watching.